Hey guys, welcome to Chiro Stories number 4. I have with me here a dear friend and colleague, Dr. Gayen Bartlett.
Thanks for having me.
Yeah, man.
Appreciate it.
And so we're excited to have him here. He's got a lot of stories to share. So today he's going to share one that's going to blow you away. I'm excited. So let's.
Well, you asked me to do this a couple weeks ago, and I've been racking things in my mind, just stories of patients and just things that we've taken care of over the years. And I'm going to take it a little bit different direction, if that's okay. It's kind of what I've been thinking about. And I will say, I'm going to preface it by giving a little bit of a story about me. When I was a kid, young kid, I was about 12 years old, probably even a little bit younger than that. I was real into magic. I was doing a lot of magic tricks and show them to family, show them to friends. The problem was, as soon as I learned the trick really, really well, it became kind of just monotonous to me. It became kind of boring. It lost its thrill for me, even though everybody else was really enjoying it and they were shocked by it a lot of times. And I just didn't get it because once I learned the trick, it seemed so simple to me, right? When I was thinking about miracles in chiropractic, the same kind of thing happened, where I will honestly tell you the last miracle that I saw in chiropractic was one of my very first patients, and this is why. Before I was a chiropractor, I interned in a lot of offices, I did a lot of things with a lot of patients, and we heard stories coming in and out of the office every single day, right? The things that you and I see every single day, and they are awesome, they're miracles, because to me, as a student and as a young doctor, if you could make a positive change in somebody's body physiologically without putting anything in or taking anything out of their body, that was a miracle to me, right? Now as a chiropractor, getting to see it every single day, it's more like that's what should happen. When we make that adjustment and remove pressure off of a nerve or change the body physiologically, there should be some kind of positive change. And what that change is, I don't know what it is, but I will honestly say the last miracle, and I've been astounded a couple times in practice, or things that got better that we didn't even expect to get better because we're not treating it. But the last miracle I saw was one of my very first patients. He came in, a young kid, about 16 years old. She had debilitating migraines, really, really horrible migraines. And I was new in practice. It was, to be honest with you, it was scary a little bit to me because it was the first person that came in, we had to have the lights in the room off. It was a serious situation. And mom's bringing me her son and expecting me to do something with it. And I shot x-rays. I saw a ton of pressure right up here, that brainstem area. And being new in practice, I just knew what I was going to go. At that point, I'm going to go try to adjust this bone, right? So we put motion in the bone, we take the pressure off, and the patient came back and said it was the first time in months that he hadn't had a headache. And the mom was astounded, and to me, that was a miracle. That was a miracle because it's first time in months, and I had done it. It was amazing because I took my hands and I put motion into an area, and that's all I did, right? I didn't give him anything. I didn't even tell him to do it. I just put motion into that joint, and the migraine went away, right? And now, fast forward, I've been about 7-8 years in practice. There are no miracles anymore because we start to just expect that thing to happen. I've had moms come in and I'm adjusting the kids, and I look up in the mom's file and in the orange box where I kind of make notes on their first visit. It said she was struggling from infertility at one time, right? Now, was it the chiropractic that it got her well, or was it just the fact that we started removing pressure on the nerves, we started taking pressure off the spine, and the body did what it was supposed to do, right? The same thing, we've had people come off of medication, high blood pressure medication. Just today, I had people coming in and telling me they were coming off of some medications, which is awesome. But it's become one of those things that you just start to almost expect that when you put motion in a joint, you relieve stress on the nervous system, the body's just going to heal. And it's almost, and you can speak to this too, I'm sure, it becomes a little bit more surprising when it doesn't happen. When it doesn't happen to the standard that we expect a lot of times with a lot of patients, because it's always happening, whether we see it or not. It's just how quick is it happening? With which patients, how quick, how long has the problem been there, all those kind of things, right?
Exactly.
So that's kind of trying to come up with one specific story. I don't want to say one thing was more impressive or anything than the others, because you do have these things. If somebody comes in and we adjust them and their blood pressure starts to get better, to me that's a miracle. Until you understand, I'm taking pressure off the vagus nerve, right? I'm taking pressure off the thoracic sympathetic nerves. That should happen. So All those things, though, in my mind, life is a miracle. Life is a miracle. So that's my long answer to the short question of where do the miracles happen.
That's great. Thank you. Thank you, Gayen.
Absolutely.
And, a lot of people think that, chiropractic is just for neck and back pain, and if they don't have neck and back pain, then they have no reason to go see a chiropractor. And, have you ever had any patients that have just come in just to get checked for subluxation or misalignment that didn't really have any pain?
Yeah, that happens. It happens now longer than I've been in practice, and you attract patients that are like the patients that you have. So once we have patients that have kind of been educated in chiropractic, we do have those, and they tend to refer those types of people. But it is, to your point, I had a patient come in that I haven't needed you for a little while because I've been in good shape. My neck hasn't hurt, and that's, to me, that's one of the most. I just want to get through to you because it's not about the pain. It's not about the neck pain. And here's the thing that me and you see all the time. When they do start to, when the pain does come on, you assess them. The underlying cause of what caused that pain happened months ago. Not because you slept weird last night, or not because you had a weird thing happen at the gym a week ago. It's stress that's been building up in that body, stress that's been building up in that joint, and that was the final straw. And that's what brought you in. But we don't adjust people for pain, right? It's amazing because when we adjust people, it takes tension off the spine, it takes tension off joints, so pain does tend to get better, muscles tend to get healthier, joints tend to get healthier. So a natural side effect of that would be pain relief, but that's not why we're here. That's not why we're doing it. So that's absolutely, that's something we struggle with. I'm sure every chiropractor struggles with that.
But that's amazing, and that's the reason why we do what we do, is to remove stress from the spine, allowing the body to heal and function the way that God intended it to. And you see all kinds of things, and just the more that people can understand that's what chiropractic is for, to amplify your life and remove any interference so that you can heal.
Yeah, absolutely. I had a mentor once say chiropractic is best served naked, just putting stress in the joint, removing pressure from the nervous system, the restriction or pressure on a joint that leads into the nerve, that puts pressure on the nervous system. That's one of the biggest detriments to a person's health. Right? And when we try to do all this other stuff around it, that's one of the biggest things that kind of waters it down a little bit. But when we can start to take the pressure off of that nerve, put motion into that joint, that's when the body heals. That's when the magic happens, right? Yep.
So if you guys have any questions, please let us know. Dr. Gayen, tell them what your practice name is, where you're located.
I practice we're in Peoria. We're 79th Avenue and Thunderbird here, over in Peoria, right off the 101 in Thunderbird. The name of our practice is ADIO Chiropractic, ADIO Chiropractic. We're pretty much a wellness, family referral-based practice. Take care of a lot of pregnant moms, a lot of kiddos, a lot of pediatrics. Just anybody who needs help, which is most people these days.
Awesome. Well, if you guys need anything, reach out to us. We'd love to help you or find you a chiropractor near your home. And thanks for watching Chiro Stories.
Appreciate you having me. I enjoy watching these. You've done a good job. You keep it up.
I appreciate it. All right, y'all.
Awesome.
Take care.
Yeah, you guys have a good one.